I'm Ross Camidge. I'm the Director of Thoracic Oncology at the University of Colorado Cancer Center. Are there any new drugs in the works for ALK-positive lung cancer? Well, the answer is yes. But what I really want you to understand is there's a great tendency to think that, oh, I just need, iPhone 10, iPhone 11, iPhone 12. I just need ALK inhibitor generation 1, 2, 3, or 4. And so every time a new drug comes out and they call it a 4th generation ALK inhibitor, you go, oh, that must be the answer for me. The reality is these things are the answers for some people, but there is no one answer for everyone. Let me try and explain what I mean. So when you become resistant to whatever ALK inhibitor you're on, you can become resistant in different ways. Now, sometimes all you're doing is turning back on ALK signaling, for example, by getting a mutation in ALK such that whatever drug you're currently on is not going to bind. There, changing to a different ALK inhibitor that maybe can bind in the presence of that mutation may be beneficial. So, for example, brigatinib has got about a 40% chance of working after alectinib. Lorlatinib has got about a 45% chance of working. It doesn't mean in an individual it's 40 or 45% benefit. What it's really telling you is that 40 to 45% of people have got these specific resistance mutations which are vulnerable to these drugs. It would be much better if you knew what was going on in your cancer, and then you could choose the right drug instead of just playing the numbers. That takes you up to, 2nd and 3rd generation drugs. 4th generation drugs, and let's be clear, these generational names are partly a marketing spin. There's no official nomenclature, but a 4th generation drug has been described by a company called Turning Point and a company called Nuvalent. And what they're working on is a particular problem, which is something called compound mutations. 2 ALK mutations occurring right next to each other, so creating a completely novel structure in that ALK that most of the original drugs don't work on. So if that's what you've got, if you've got a compound mutation, maybe a 4th generation drug is going to be the thing for you. But if you don't, it's not going to be any better. What people are really looking at is identifying second drivers, other pathways that become active, and then combining together drugs. So that's really about finding drugs which can mix together nicely. They don't interact in a bad way, that you're not having to take 50 pills a day, for example. And then finally, I think maybe what we're also looking for in terms of new drugs is many of these drugs, sure, they're an ALK inhibitor, but maybe they also inhibit a few other pathways. Now, it's traditional in the field of drug development to claim that whatever else your drug hits must be an advantage, but sometimes it's not. Sometimes it's just unnecessary baggage which is giving you side effects. So some people are looking to dial out some of those other pathways to see if you can make a drug as effective as the ones we have, but perhaps with fewer side effects. And as we become more mature and sophisticated in our approach to treating ALK-positive lung cancer, knowing you might be on these pills for years, those side effects actually become important. This isn't no pain, no gain anymore. What we want is a pill that can control the disease and give you essentially normal quality of life. So yes, there's an efficacy element, but there's also a tolerability element in new drug development for ALK.